coming here and getting totally
like Hungary, but now by the efforts of Dr. Arul and the courage and faith of Dr. Manickam in Arul and this new system, we are inaugurating this wonderful equipment. Oncotherma, also known as hyperthermia, originates from deep traditions of Hungarian natural sciences genius. This small ancient nation has given 17 Nobel Prize scientists to the world, of which 4 are in medicine, 4 in chemistry and 3 in physics. As we struggle in our fight against cancer, the integrative, patient-focused approach should be our ultimate goal. This approach builds on the totality of evidence. We here are present to observe this totally integrational, patient-oriented approach as opposed to protocol and pharmaceutical-centered medicines. These proven beneficial integrative therapies may come from ancient knowledge in Ayurveda and Siddha also. Oncothermia is exactly the embodiment of modern quantum physics for every medical use, but its roots are in millennial depths of beneficial heat against cancer. As a form of hyperthermia therapy, oncothermia uses electromagnetic energy to heat and selectively kill cancer cells. It is based on the principle that cancer cells are more sensitive to heat than normal cells. Thus, these cancer cells might be selectively killed and they are rendered more susceptible to other treatments such as chemotherapy or radiation therapy. Use of oncothermia adds a 30 to 40% success boost rate in progression-free survival to radiation and chemotherapy. The use of oncothermia as a monotherapy in palliative settings and late-stage cancer patients has yielded many spectacular, almost miraculous cures. Oncotherm, a well-reputed, the manufacturers of medical equipments in Hungary have manufactured world-leading medical devices for the last 30 years with firmly established high medical quality, registering medical devices in Europe under the strictest MDCE marking quality assurance scheme. The effectivity has been especially appreciated in Germany, where Oncotherm partners with the first-ranking medical faculty, Charlie Berlin, in clinical research, while there are 201 Oncotherm systems working in Germany alone. In the Asian continent, India as a young sister joins Korean and Japanese healthcare sectors from today, where the established and working Oncotherm systems are more than 300 together. With the new world-class system in India, first of its kind, Mirakle Integrated Therapy Center is a pioneering institution for the benefit of every patient from all parts of life, caste and disease stages. My best wishes and greetings and congratulations to the firm and also to Dr. Manickam and Dr. Arul for this innovative intervention being brought to not even to the state capital or a district capital, to a small town like Pollachi. So Pollachi will be on the national map as the pathfinder, pathbreaker for a new type of treatment, successful treatment of cancer and all that. I'm happy to be given this opportunity because I am committed to integrated medicine. I encourage wherever I find such thing happening. So, Ayush also. We are not against allopathy. I call Ayush as allopathy, Ayurveda like that. So, what you need is integrated approach. Not only traditional or all systems work together to combat these newer types of diseases. And thank you very much. Namaskaram.
Thank you, sir. Guest is someone who brings wisdom, experience, perspective, and motivate others towards greatness. Srirangam R. Murali is the head of programs at All India Radio Doordarshan, Kendra, Coimbatore, with 33 years of experience in the field of broadcasting. He has trained 130 physically challenged individuals to become radio jockeys. Murali has interviewed famous cricketers like Indian team captain Venkat Raghavan, B.V. Kumar, and Sharath Kamal, TT champion. He has also interviewed Arjun Award Kabaddi champion Miss Anjali and Miss Janita Anto, World Chess champion in Paralympics, conducting a live program from her home, broadcast over AAR Tirchi. In addition, he has interviewed Dr. Vasantha Samuel, international pole vault champion in veterans category. Now, we would like to invite Sri R. Murali, program executive, All India Radio and Doordarshan Kendra, Coimbatore, to address the gathering.
இனியவர்களே உங்கள் அனைவருக்கும் வணக்கம். Good morning to you all. You regard for our Hungarian friends, distinguished guests on the dais, our beloved chairman, our chief guest, former CBI director. It's a great opportunity for me to participate in this meet along with our former director, because I also belong to a policeman family. And distinguished guest from Hungary and distinguished doctor from Singapore, and our own Dr. Kivi Kandasamy of our Vedanayagam Hospital, and my beloved friend Dr. Arul, the secretary of this institution. I thank you all for giving me this wonderful opportunity. I want to think why a media man has been invited. Normally media man will be there in the pavilion or in some press here, and we used to cover the function. It is a little bit emotional to me to come here, because one of the greatest thing is that this institution has been pervaded by the noble soul, our Aruchelvar Ayya. That too in his centenary year, this great facility for this cancer patient is being offered by this institution. Normally an engineering college, they are the facilitators for materialistic happiness. But here they have now become a facilitator for health. When health is lost, everything is lost. We know that. Even we can buy back the wealth, but not the health. With regard to emotional, I lost my father and my sister. My sister was only 58 years old. She died out of breast cancer. Our chairman said, I really congratulate, or I really send my best wishes to some of, I won't call them as patients. They are great fighters. I just want to congratulate them. They are also in the midst of the crowd. So, in those time, miracle never happened, as now the miracle is going to happen in this campus. We believe in allopathy. Yes, any emergency, any traumatic things, definitely. My own daughter is a dentist. So we believe in it. But understanding the disease is most important. That too, understood by the patient. Why I am saying is that, as our former director rightly mentioned, our Arutselva, every time I used to go and meet him during the Vegetarian Congress at Trichy. Along with him, I used to record the great man, Dr. Giridhari Prasad. So, he said, we know very well, our Arutselvar is based on two principles. One is Mahatma, number two, Vallalar. Kadaivirithen Kolvar illai. But here our Arutselvar took that. In one of his book he has said, I am not proud of the property I bequeathed from my father, but I am grateful to him because he introduced two people to me. One is Mahatma and another is Vallalar. So in that way, in that Vegetarian Congress, Unave Marundu, food is the medicine. That is the principle our illustrious chairman has formed here, this great center. So, when we understand the disease, especially the patient, that too, fearless treatment. As soon as we see, because I frankly tell you, our former director said, media are devoting big space for Bollywood and other showy business, showbiz. But I tell you, sir, you know very well, when you met me today, I was very much enamored because you said, All India Radio and Doordarshan, you are doing wonderful job. Yes, we give little space. Of course we give. We also want revenue. Days have changed now. But at the same time, we want to disseminate information to the public in a very simplistic form. That's what I requested our chairman. Sir, we should cut across the entire population with a very simple message of the treatment being going on or in progress at Mirakle Center. So, that is my challenge now. How to get across the message in a very simple form to the great population which is still under illiteracy. Our ordinary people, we don't know. Even I just thought today, if there was some center at that time, I could have saved my sister, who is very dear to me, just like my mother. But that never happened. Now, a wonderful opportunity is being extended by this institution and our chairman, and we can make use of it. First of all, let us not feel that this cancer will devour or it will swallow us. That is the greatest thing that the patients should understand. In that way, it's a great thing to be here in this wonderful morning. This hypothermia, there is a sutra in our Mahabharatam, Garuda Purana. In our own land we have. It's called as Jwara Sutra. Actually, they used to pray because in those days they were very fear of this fever. So they used to pray. So in our own land, we have certain things. And as our chairman said, integrated, that is holistic approach, as our former director CBA also mentioned. A holistic approach is the need of the hour. That doesn't mean allopathy doesn't help us. Definitely it helps us. For people like me in media, if we take a tablet in the night, we will be all right for a presidential coverage the next day. So this can happen only in allopathy. Of course, that is not the correct way actually. Even the physicians, they advise, don't control immediately. take little bit of medicine. And there is another one, our chairman was telling about a gentleman. There is a proverb in Sanskrit, Langanam Parama Aushadam. That is when they will say, starve the fever, feed the cold. That's the English proverb. So there is certain things which if we follow, definitely we can get out of this dreadful cancer, and cancer will never kill us. We will kill cancer, don't worry. So things are going to happen like that. In that way, it's a very nice thing. Once again, I thank our chairman and all the distinguished guests for giving me this opportunity. Thank you very much. Jai Hind.
Thank you, sir. Vedanayagam Hospital stands tall with their tireless effort to increase the standard of health care in urological and nephrological care, Coimbatore, for more than 40 years. It is headed by Dr. S.V. Kandasamy, is the creator of the groundbreaking extensive kidney transplantation and other urological procedures with increased success rates and reduced post-operative problems. May we call upon Dr. S.V. Kandasamy, Chairman, Vedanayagam Hospital, to deliver the special address.
My dear friends from Hungary, let me tell you that fairly a good amount of this audience don't understand the English that well. So I am going to speak in the local dialect Tamil. You will excuse me. If there's any doubt, you ask me later. Okay? Right. மேடையில் அமைந்திருக்கும் மதிப்புக்குரிய நண்பர்களே, இந்த விழாவிலே கலந்து கொள்ள வந்திருக்கும் அனைத்து நண்பர்களுக்கும் என்னுடைய காலை வணக்கங்கள். நான் ஒரு பெரிய ஸ்பீக்கர் இல்லை, நான் டாக்டருங்கிற முறையில் இந்த பவர் பாயிண்ட் ப்ரெசன்டேஷன் போட்டு அதை பார்த்து படித்தே தான் பழக்கம். தனியாக பேசுகிறதுக்கு இங்கிலீஷில் அவ்வளவு ஃப்ளூவெண்ட்டாக பேசுகிற மாதிரிலாம் இல்லை. அதனால் தமிழ்லேயே நான் பேசிடலாம் இன்றைக்கி. ஏன்னா நிறைய பேர்த்த பார்த்தா உங்களுக்கு இங்கிலீஷ் அவ்வளோவா புரிகிற மாதிரி தெரியல, அதனால் நான் தமிழ்லேயே பேசலான்னு முடிவு பண்ணிட்டேன். நான் ஒரு டாக்டர் கந்தசாமி. நான் மெடிக்கல் காலேஜில் சேர்ந்தது 62 வருஷத்துக்கு முன்னால், 1961. ஆனால் நான் மெடிக்கல் காலேஜில் சேர்ந்து இன்றைக்கி டாக்டராக இருக்கிறேன்னா அதுக்கு காரணம் என்னுடைய அத்தை மகன் அருள்செல்வர் மகாலிங்க அவருங்க. உங்களுக்கெல்லாம் நிறைய தெரியாது. நான் அவர் வீட்டில் இருந்து தான் பியூசி கோர்ஸு இங்கே என்ஜிஎம் காலேஜில் படித்தேன். அப்படின்னா நினச்சி பாருங்கள், அவர் வீட்டில் தான் ஒரு வருஷம் இருந்து பியூசி அந்த காலத்தில் 1959-60 படித்தேன். ஆனால் பியூசியில் ஃபெயில் ஆகிட்டேன். அதனால் ஒரு வருஷம் அவர் எனக்கு மெடிக்கல் காலேஜுக்கு இடம் வாங்கி கொடுக்கல. நான் அக்ரிகல்ச்சர் காலேஜில் படித்தேன். அப்புறம் அடுத்த வருஷம் போய் எப்படியாவது எனக்கு வாங்கி கொடுங்கன்னு சொல்லி அவர் இன்ஃப்ளூயன்ஸ் கொடுத்து எனக்கு மெடிக்கல் காலேஜில் சீட்டு வாங்கி கொடுத்தார். இல்லைன்னா நான் டாக்டர் இல்லை, ப்ராபப்ளி சங்கம்பாளையம் வில்லேஜில் ஏதாவது உழவு ஓட்டிட்டு அக்ரிகல்ச்சருக்கு இருந்திருப்பேன். நல்லா இப்போ டாக்டர் ஆகிட்டேன். ஆனால் அவர் என்னை டாக்டர் ஆனதுக்கு எனக்கு ரொம்ப சந்தோஷமான நிகழ்ச்சி. நான் எல்லாம் டாக்டர் தொழிலெல்லாம் முடிச்சுட்டு இங்கே கோயம்புத்தூர் வந்து ப்ராக்டிஸ் ஆரம்பிச்சிருந்தேன். அப்போ வேதநாயகம் ஹாஸ்பிட்டல் கூட அப்போ தான் கட்டிகிட்டு இருந்தோம். அப்போ ராமகிருஷ்ணா ஹாஸ்பிட்டல் தான் ஆப்ரேட் பண்ணியிருந்தேன். ஃபஸ்ட் டைம் கிட்னி டிரான்ஸ்பிளான்ட் பண்ணேன் 1979. சவுத் இந்தியாவிலே வெள்ளூர் தவிர வேறு யாருமே டிரான்ஸ்பிளான்ட் பண்ணதில்லை, அதுவும் ப்ரைவேட் ப்ராக்டிஸில். அது பேப்பர்லெல்லாம் வந்து அவர் என்னை கூப்பிட்டு ஃபோன் பண்ணி ரொம்ப சந்தோஷமாக இருக்குப்பா, நீ நல்லா பண்ணியிருக்கேன் அப்படின்னு சொல்லிட்டு. தட் இஸ் த ஹாப்பியஸ்ட் மூமெண்ட் ஆஃப் மை லைஃப். இப்போது இந்த 62 வருஷத்தில் அஃப்கோர்ஸ் எஸ் எ டாக்டராக நான் 52 வருஷமாக ப்ராக்டிஸ் பண்ணும்போது இதில் எத்தனையோ புது நிகழ்ச்சிகள் நடக்குது. புது எக்யூப்மெண்ட்டெல்லாம் வந்திருக்குது, ட்ரீட்மெண்ட்டெல்லாம் மாறிட்டே வருது. அன்னைக்கு இருந்தது நான் படித்து நான் ப்ராக்டிஸ் பண்ண வந்த அந்த மாதிரி ட்ரீட்மெண்ட்டெல்லாம் இப்போ இல்லை. அந்த மாதிரி ஆப்ரேஷன்ஸ் எல்லாம் மறைஞ்சு போச்சு. இப்போல்லாம் ஓப்பன் ஆப்ரேஷனுங்கிறதே ரொம்ப கம்மியாகி போச்சு. இப்போ லேப்ராஸ்கோப்பி இல்லாட்டி ரொபாட்டிக் சர்ஜரின்னு சொல்லி எல்லாம் பண்ண ஆரம்பிச்சிட்டாங்க. அதனால் ட்ரீட்மெண்ட் ரொம்ப இதாகிடுச்சு. அதே மாதிரி கேன்சர்லேயும் எத்தனையோ ட்ரீட்மெண்ட் வந்துருச்சு. ஆனால் இன்றைக்கி இருக்கக்கூடிய இந்த ஆங்கோதெர்ம் அப்படிங்கிறது ஒரு பெரிய ரெவல்யூஷன் நான் நினைக்கிறேன். அது இன்னும் எல்லா பக்கங்களுக்கும் போய் எல்லா டாக்டர்ஸும் எல்லாத்துக்கும் போய் சேரல. அதனால் எனக்கே கூட இப்போ தான் தெரிஞ்சிச்சு. இப்போ எனக்கு ஒரு 10 நாளைக்கு முன்னால் அவர் ஃபோன் பண்ணி சொன்னார், இப்படி இது அதுன்னு சொல்லிவிட்டு இந்த மாதிரி எக்யூப்மெண்ட் வாங்கியிருக்கிறோம், 4 crores காசில் வாங்கியிருக்கேன், நீங்கள் கட்டாயம் வரணும் ஓப்பனிங் செட்னு சொல்லிட்டு. அப்போ தான் எனக்கே தெரிஞ்சது இப்படி ஒரு எக்யூப்மெண்ட் இருக்குதுன்னு சொல்லிட்டு. ஆனால் இது ஒரு ரெவல்யூஷனை ஏற்படுத்தும் அப்படிங்கிறதுல எனக்கு ஒன்றும் சந்தேகமே இல்லை. ஆனால் ஏன் இந்த கேன்சர் எனக்கு கொஞ்சம் இன்னும் க்ளோஸாகவே ஒரு க்ளோஸ் டு மை ஹார்ட் கேன்சருங்கிறது. ஏன்னா எங்கள் அப்பா இது என்எம் மகாலிங்கத்தினுடைய தாய் மாமன் 45 வயசில் மூத்திரப்பையில் கேன்சர் வந்து அதனால் ரொம்ப கஷ்டப்பட்டார். யூரினில் பிளட்டாக கட்டியாக வரும். அது கடைசி ஸ்டேஜில் தான் அவர் சொல்லி அவர் மகாலிங்கம் தான் அவர் மெட்ராஸுக்கு கூட்டிகிட்டு போய் ஆப்ரேஷன் பண்ணாங்க. ஆப்ரேஷன் பண்ணி ட்ரீட்மெண்ட் ஒன்றும் சக்ஸஸ் ஆகலை. அவர் அந்த ஏஜ்லேயே 45 இயர்ஸ்லேயே இருந்தார். ப்ராப்ளி அதனால தான் நான் டாக்டர் ஆகணும்னு ஒரு பிரியம் வந்தது. அப்புறம் இந்த கிட்னி சம்பந்தமான டாக்டர் ஆகணுங்கிறது அதுக்கு பிறகு தான் அந்த இது வந்தது. அதனால தான் நான் கிட்னியில் ஆன உடனே கான்சன்ட்ரேட் பண்ணி இந்த பிளாடர் கேன்சர் ரிமூவ் பண்ணுறதுல நான் ஸ்பெஷலாக இது பண்ணுவேன். அதனால் 4 hours 5 hours 6 hours ஆகும். பிளாடர் கேன்சரை எடுத்துகிட்டு குடல்லையே ஒரு மூத்திரப்பை மாதிரி ஒரு இது பண்ணி அதுவும் ஒரு ஸ்பெஷல் ஆப்ரேஷனை நான் பண்ணிகிட்டு இருந்தேன் அந்த காலத்தில். கோர்ஸ் இப்போ புதுசாக வேறு இதெல்லாம் வந்துருச்சு. அதனால் தட் இஸ் வை இந்த இதுக்கு. அதனால் இந்த எக்யூப்மெண்ட்டு இன்னும் பாப்புலர் ஆகணும் அப்படின்னு சொன்னால் இது கேன்சர் இருந்தது, ட்ரீட்மெண்ட் கொடுத்தோம் நல்லாயிட்டுன்னு சொன்னால் பத்தாது. இது எல்லாம் ரெக்கார்ட் பண்ணணும். இந்த ப்ரீ ஆப்ரேட்டிவ்னு சொல்லிட்டு ஆப்ரேஷனுக்கு முன்னாலேயே பேஷண்ட்டுக்கு எல்லாம் சிடி, எம்ஆர்ஐ, பெட் ஸ்கேன் அதெல்லாம் பண்ணி ரெக்கார்ட் பண்ணணும். அதுக்கு பிறகு ட்ரீட்மெண்ட்டுக்கு முடிஞ்ச பிறகு கம்ப்ளீட்டாக க்யூர் ஆன பிறகு மறுபடியும் இந்த டெஸ்ட்டுக்கெல்லாம் பண்ணி டெஃபினட்டாக க்யூர் ஆகிருக்குன்னு இப்போ தான் மெடிக்கல் கம்யூனிட்டி அதை அக்செப்ட் பண்ணுவாங்க. இப்போ எல்லோரும் சும்மா நம்ம போய் நல்லா ஆயிடுச்சுன்னு சொன்னாலாம் என்ன ஒத்து மாட்டாங்க, அதை இப்படி தான் சொல்லுவாங்க அப்படின்னு சொல்லிடுவாங்க. அதனால் இப்போ நான் மாணிக்கம் அவர்கிட்ட இப்படி தான் சொல்லிகிட்டு இருந்தேன் நான், நீங்கள் எல்லா கேஸுக்கும் நீங்கள் இது பண்ணணும், ட்ரீட்மெண்ட்டுக்கு முன்னால் பண்ணணும், பின்னால் பண்ணணும், அதை ரெக்கார்ட் பண்ணி இதை ப்ரெசென்ட் பண்ணணும். மெடிக்கல் மீட்டிங்ஸில் ப்ரெசென்ட் பண்ணிங்கன்னா தான் டாக்டர்ஸ் அக்செப்ட் பண்ணுவாங்க. இல்லாட்டி எந்த ட்ரீட்மெண்ட்டுமே அவங்க அக்செப்ட் பண்ண மாட்டாங்க. அதனால் அதை தயவுசெய்து பண்ண சொல்லியிருக்கேன். அஃப்கோர்ஸ் மிராக்கிள் இதை ட்ரீட்மெண்ட்டை பற்றியெல்லாம் நிறையா சொன்னாங்க. நான் மிராக்கிள் ஐவி மிராக்கிளெல்லாம் எடுத்தது வைட்டமின் சி எல்லாம் எடுத்ததில்லை. ஆனால் டெய்லி மார்னிங் மிராக்கிள் ஒரு இது என் டேபிளில் பிரேக்ஃபாஸ்ட் டேபிளில் வந்துடும். ஏன்னு கேட்டால் அது மெடிக்கல் இதுக்கு தான் என்னமோ தெரியாது எனக்கு, ஆனால் டேஸ்ட் நல்லாயிருக்கு. அதனால் தினமும் மிராக்கிள் இந்த இதில் வந்துடும். அதனால் ஹோப்ஃபுல்லி இட் வில் ஹெல்ப் மீ ஆல்சோ. ஐ வில் நாட் கெட் அ கேன்சர். மிராக்கிள் வில் டூ அ மிராக்கிள் ஃபார் மீ ஆல்சோ. ஏன்னா நிறைய பேர்த்துக்கு மிராக்கிள் உண்டு பண்ணுதுன்னு சொல்கிறாங்க. எனக்கும் ஒரு மிராக்கிள் ஏற்படுத்தும்னு நினைக்கிறேன். அதனால் கேன்சர் வராமையே நானும் தப்பிச்சுக்கலான்னு நினைக்கிறேன். அதுதான் விஷயம். அதனால் இந்த ஃபியூ வேர்ட்ஸோடு என்னை இந்த மேடைக்கு என்னை திடீர்னு என்னை கூப்பிட்டாங்க பேச சொல்லி. ஏன்னா நான் நினைக்கவே இல்லை என்னை கூப்பிடுவாங்க டேபிள்லன்னு சொல்லிட்டு. அதனால் இன்னும் ப்ரிப்பேர்டாக இருந்தால் இன்னும் கொஞ்சம் மென்டலாக என்னென்ன பேசலாம் என்னென்னலாம் இது பண்ணி கொஞ்சம் எழுதிட்டு வந்தெல்லாம் பேசியிருக்கலாம். திடீர்னு பேச சொல்லிட்டாங்க. இங்கே வந்த பிறகு சொன்னாங்க. அதனால் அதுக்கெல்லாம் சான்ஸே இல்லை. அதனால் ஏதாவது நான் பேசுனதில் தப்பாக இருந்தால் மன்னிச்சுக்குங்க. உங்களை அனைவருக்கும் என்னுடைய வணக்கங்கள்.
Thank you, sir. A great leader knows how to inspire, motivate, and empower their team to achieve the goals. He is the manager and owner of both the German and Hungarian Onkotham companies. His task is to define the right long-term strategy that will help a positive impact on the future and operation of the group. Finding new areas and cooperation partners, building relationships are his key areas. His works on ongoing consultations with the middle managers, ministries, and oncology institutes. He actively participates in the preparation of clinical trials and domestic and EU applications. Now, we would like to invite Sri Balas, CEO, Proprietor, Onkotham Limited, Hungary, to address the gathering.
I'm a little bit taller. Sorry, I'm a little bit taller than usual. Can I? Oh. It takes a little time, but. Sorry? Okay. It's okay, it's okay. Thank you. Most mindenki le van. Neked jó lesz. Can I get something? Do you have something to change the slide? Sorry. Okay, thank you. Okay, thank you so much. You can hear me now. It is my great pleasure to be here. Thank you so much for your invitation. Thank you so much that I can be here. This is my first time in India, and I am very touched that it's a very beautiful country. And my name is Balázs Ács, and I am the CEO of the company. I'm a little bit younger, but the company was established in 1988, more than 35 years ago. So I was only 5 years old. But, but Professor Szász, who established the company in the right side, and then Dr. Oliver Szász, who is co-owner and advisor in the company. So, please change. So I would like to talk about a little bit the missions and the motivations. The motivations, how start the Oncoterm. Unfortunately, András' mother died in cancer, and András was so sad for these things that he decided that he wants to do something against the cancer, because it was a very high chance that his sister could somehow genetically inherited this type of cancer, and then he wants to find the solutions. He wants to save his sister's life, and that was the motivations. That was the start when he started to develop and started to research a new possibility, a new hope, and he was able to do this device, able to do this method. And started the companies in 1988, and when his sister developed this cancer more than 20 years ago, he was ready with the device, he was ready with the method, and he could cure his sister. And this is maybe one of the best if he could help somebody, and our family member, somebody who is very close for us. And he was able to help his sister. So the other very important is the philosophy of the company. Our cultures, it's possible that it's different, but the philosophy and how we try to cure the patients is very, very similar, because we want to cure the patients. And we want to help to the patients and not focusing for the cancer. We are focusing to to the patients. And this is our goal, that we want to give higher chance for the survival time, and we want to give a better quality of life to the patients. And these are the two most important things, I think. Yeah, please. The company was established, as I told you, 1988 in Hungary, and the first clinical trial started in Germany in 1990s. The device could get the CE approval since 1998. This is very important because when we started the development, the TUV and the government said that it's not possible to get a license for this device, but we proved that it's possible because we have enough proofs and enough clinical evidences that this device is effective. Our place in Hungary deals with the R&D, the manufacturing, the marketing, and the sales activity. We employ more than 50 people, and we have more than 100 suppliers who deals with electrical components, mechanical components. And we have a company in Germany as well. And, which is very important, that we have a medical ISO system. This gives a right to develop a medical system, and we have a CE approval as well, which give us a very, please back. So we have a CE mark, which means that this device is on a very high standard and it's fulfilled the EU MDR requirements. Now the EU MDR requirements is the most strict regulation in the world. It's much more strict than, for example, the US FDA. You will see that now if somebody has EU MDR standard, that company could fulfill the most strict requirements on the world. So this device, this method has enough proofs to fulfill the requirements of MDR. A company presents in around the world in more than 35 countries in 5 continents, and we have installed more than 600 devices around the world. And we are dominating more than 65% of the market. We have competitors from US, from Italy, from other countries, but our device is one of the best, and most of the customers choose our device around the world. We treat more than, we have treating more than 400,000 per year, and we have very strong connections with university clinics around the world, and we have more than 200 installations in Germany and more than 250 installations in South Korea. And Germany, this is paid by the insurance. This is very important. That is the German government, the German health ministry accepted this method, and we have a lot of proofs, a lot of publications. We have own books, book chapters, and so on, which published and available. Cooperation partners, for example, from the universities. Charité, no, please put it back. It's too slow. Wait, back. So, the first is Charité Berlin. Charité Berlin is a very huge and famous Charité Berlin. We started a professorship. Professorship means that Charité will focus for the Oncoterm method, and they will do clinical trials with Oncoterm method. They establish this professorship, and one professor will deal only with Oncoterm treatments and Oncoterm methodology. Second, Valladolid University in Spain. They are doing now a glioblastoma multiform clinical trials, and now they are preparing the pancreatic cancer clinical trials as well, because the first results with the GBM is very promising and very good. And we have a very strong connection with Summer's University as well. They're starting the best breast trial and colorectal trial very soon. And we have connection with UCL, the University College of London, and they are doing a glioblastoma multiform study. It is very important that UCL is one of the best, the 22's position in the world ranking in the best universities. And Charité Berlin is also very good. And the Saint-Marves University is also good. And Waldorf University is one of the biggest and most best equipped hospital in Spain. So these universities and these institutes use our device, and they are satisfied. If these universities could be satisfied with the methodology, this could mean that we could be successful and we could help to the patients. What is our mission? How works the Oncotherm? We talked about many times, and maybe you know it, but just to refresh these things. So this is a 30.66 megahertz what we are using during the treatments, and the tumor has higher metabolic rate. The better conductivity will cause that the tumors will be much more conductive, and we are able to focus the energy to the cancer cells and able to heat up the cancer cells selectively. And this is a non-toxic, not invasive method, and we could cure the patient with heat and plus modulated electric field. This modulated electric field will cause apoptosis and not necrosis. This is a huge difference. If we could teach the immune system that something is wrong inside the body, and something is wrong inside the tumor cells, then we could show to the immune system what needs to attack. This immune response is instituted in real time, and this is a patented process in a lot of countries, like in EU, in the US, in South Korea as well. So, the abscopal effects. The abscopal effects mean that we are able to treat the patient far away from the scope. We treat the primary tumor locally, but we are able to do the systematic effect. So it is visible on the PET scans, PET CT scans that also active the tumors in the tissues, and it is visible before the treatment, then after the treatment, that the activity is much more lower in that area where the patient was treated. Only the primary tumor was treated. Which is very interesting, that we could treat such kind of sensitive organ than the brain. It is not possible to treat with other type of hyperthermia systems, just Oncotherm, which could capable to treat, for example, brain. This is the astrocytoma, 24 years female patients, G3 the diagnosis, and after 3 months, it's visible the change. Additional 4 years, and additional 9 years. So we treated the patients for more than 30 years, and the average survival time would have been 18 months. And we treated the patient more than 7 times more, 7 times higher was the treatment time than the average survival time. So this is a huge possibility to the patients that they could survive much more with good quality of life. And this is the most important. It is possible to treat such kind of organs which is close to the eye, and it's totally cured after 6 sessions, these patients. And non-Hodgkin lymphoma, this is also very close to the eye, and this was also possible to cure. Only that region was cured, and it's visible the huge differences. Mammocarcinoma, it is a bleeding type of cancer. This is also possible to cure. The normal standard hyperthermia cannot cure such kind of treatments, such kind of diseases like the mammocarcinoma. This is a triple-negative locally advanced breast cancer. It is visible that it is a huge type of cancer, and visible on the PET CT that also active the tumor cells, also active the tumor tissues. And not only the breast was cured, but the spine. If you see on the PET-CT, but metastasis was in the spine, but after the treatment, 7 sessions combined with radiotherapy, not only the breast was cured, but the metastasis also disappeared from the spine. This is also a huge thing. Clinical results. The advanced inoperable pancreatic cancer, stage 4, it is visible that the normal standard treatments shows only 40.2% chance for the first year survival. And what we do, that this is 3 times higher chance with combination with Oncotem. This is pancreatic cancer. Another one, glioblastoma multiforme. The patient has 20.8% chance for the first year survival. But with Oncotem, again, more than 3 times higher chance for the first year survival. And it is visible that in totally, in 5 years, the chance is also 3 times higher than with the normal standard therapy. So in combinations, the Oncotems could work very well. We have, of course, clinical trials, phase 3 randomized clinical trials with cervical cancer. We involve more than 236 patients in this clinical trial, and it is visible that the 3 years disease-free survival was much higher in combinations than the normal standard alone. Only 35% chance in that group which used only the standard therapy, and nearly 60% chance to that patients which was treated by Oncotem and the standard therapy. This is our product, the HY 2030. This was bought by this clinic. And what I wanted to say, that the Oncotem, like a violin maker, we can produce and develop a very nice product, a very nice method. But the violin maker cannot do anything without the players. And the players, like professional doctors, could use that device. So this is our violin. You are the professional player. Please play with my violin. Thank you so much.
Thank you, sir. An investigator is someone who is committed to uphold the principles of fairness, integrity, and honesty. Marcel Sars graduated as MD and earned his PhD and habilitation degrees both from Semmelweis University, Budapest, Hungary. He has been a visiting scholar at the medical faculties of Charité University in Germany, the Johns Hopkins University, Harvard University, and the University of Chicago in the USA. He is board certified in pathology, and his main focus of interest is blood and tissue-based translational research in solid tumors, including but not limited to the biomarkers of breast and malignant melanoma. Marcel is a member of several European and American medical societies and Secretary General of the Hungarian Society of Senology. Now, we would like to invite Dr. Marcel Sars, Principal Investigator, Department of Oncology, Faculty of Medicine, Semmelweis University, to address the gathering.
Thank you so much. Can you hear me? Yes. All right. So, a big thank you for invitation. I'm also a first-timer here in India, and I'm really thrilled by the welcoming attitude and by the nice and warm-hearted people here. So, I come from Sweden right now, from the snow, and I'm really happy that I can stand here. It was really cold. So I have some other disclosures to make. First of all, my name is Sars. As you have seen, it's pretty much similar to the founder and the inventor of these machines, but we are not related at all. And this is not a frequent name in Hungary, but still we have the same last name. So I have no financial disclosure. And yes, I'm a pathologist as well. I do pathology 50% at Karolinska in Sweden, and I do oncology, medical oncology in Budapest, Hungary. So this is more like a Renaissance doctor who stands in front of you. We had most of our patients with pancreatic cancer and treated with hyperthermia, and now I look at pancreatic samples at Karolinska, part of the pancreatic team. So the other disclosure I have to make, I failed in medical school in one subject, and that's pathology. And I grew up also with my grandmother having breast cancer. So it's maybe not genetic, but definitely we have an imprint on ourselves, probably. And of course, I got the topic of breast cancer at my pathology exam in medical school. So I probably didn't cope with it well. And this is partly maybe the reason I became a pathologist, breast cancer specialist, how they would say. And I have looked at many of these cancer types, thousands of cases, and I can tell you, I don't know what I look at. So much about my statements. I think that the biggest honor I got last week from one of my colleagues in Stockholm. She's from India, and she came to me, and this was the biggest honor I think I ever got, that she asked me, as a pathologist, to look at the sample of her friends, because she has breast cancer, and she wanted to have my opinion beforehand. So we got the slides earlier than the breast cancer specialty subgroup, and they were pretty much interested, of course. Anyway, we can go on. This is a prediction on cancer. In the next almost 20 years, we will see a doubling number. Globally, I know that India has much nicer numbers, but for instance, Hungary has much worse. So if we go on and we look at the cases, we will reach these statistics, sadly, in Hungary by 2030, so 10 years earlier than globally. So what is our vision on this? We have to see cancer as it is, we have to diagnose, and we have to improve treatment modalities and cure more patients possibly, because we won't have the personnel, we need new violins, we need the Paganini of hyperthermia to help us. So there are challenges to face with early detection, finding optimal treatment, and efficient follow-up, of course, with reintegration into the society and family, and also part of healing the family itself through the quality of life. So, as a pathologist, what could I say? We see morphology, we see the genetics. Of course, we don't see the family, which is a problem, and probably we miss a huge part of the diagnostic spectrum by just looking at something that's there, but I mentioned I don't know what I look at, right? So there are various approaches, various treatment modalities. Western oncology is based mostly on surgical, radiation, and medical oncological fields, and the fourth pillar with hyperthermia is just about to come and supplement our everyday practice. So we are looking on the patients, we are looking at the families, we are discussing stress, we are discussing possible inheritance, and we want to have a more transparent approach, because the more cooperations we will have from the patients and the families, the more successfully we will be able to treat them, likely in the near future. So we have to have a high quality data which is showing ourselves the hidden parts of oncology as well. So what is our method we use? Of course, I don't want to repeat everyone. You learned a lot about hyperthermia, but I would point out this guy on the right upper side. I heard nicely that how many Nobel laureates we have in the country. Not so many. So Hungary is like a big Indian city, I would say, by population. And our scientists tend to leave before the Nobel Prize. So this guy has been honored for the discovery of vitamin C. So I think it's really a thrilling announcement here where you use vitamin C with the patients. And the rest of his life he spent in Massachusetts near Boston. And he was investigating cancer, which is not known too much. And this we call Sanjurji effect, that the current that goes through the body is auto-focusing on the tumor cells because of its biophysical properties being detached from each other. And this gives us the opportunity to use advantage of such a method and the device in this oncological treatment. So I try to simplify the method into pieces, but selective heating of the malignant cells occur, and that changes the metabolism because we speed up even further the metabolism, so they won't be able to cope with that. Secondary phenomenon is a damage on the cell membrane of the tumor cells, so the immune system would come there and recognize the tumor cells in a much more efficient way. And of course, controlling the blood flow, causing dilatation, is really effective when you give other drugs, for instance, vitamin C or chemotherapeutics, if you would like that, to give a more efficient treatment against the tumor for the patient. And as well as told, it's abscopal effect, which we know from radiation oncology, that we irradiate one part of the tumor, but it can shrink on the other side as well. We believe or we understand that it's an immunological effect of this treatment. So this is just the guideline that we wrote up a few years ago on modulated electrohyperthermia. We can just go on. Yeah. So the early days, of course, with medicine, we start there with all kinds of medication, including hyperthermia, that we try to treat the patients who are in the last stage, and we try to step back and back and back to earlier stages. So the first patients and the first investigations went on with a palliative setting, either in combination with other therapies if the patients could take it, or either in monotherapy. I would only show you some imaging cases. We had a few studies going on in my department in the past 7-8 years. One of our focus was the hepatopancreatobiliary region, mostly pancreatic cancer, which is a big deal in Hungary. So if you look at the left side with that liver, you see that shrinking tumor on the right. The same here. Oh, this is already a breast cancer metastasis that has metastasized to the liver as well, and we were able to shrink the tumor to a lower size. The same has happened in the brain from breast cancer metastasis. As you see on the left, the whitish areas are the tumors, and after applying oncothermia, the tumors have shrunken to smaller sizes, causing her a good health status. We would say ECOG 1 or 0. This is the best state with how we walk around. Thank you. And this is a glioblastoma, which was, I think, shown by Balázs to some part, but this is a different case by Professor Fiorentini, who treats pancreatic and glioblastoma mostly. And he could shrink this tumor in just 4 months to this size. Okay, rectal cancer, this is maybe a little bit harder to see. You just want to appreciate the extended or infiltrated and thickened wall of this organ, and applying hyperthermia with the modulated electromagnetic way, this patient could have a very good response, no pain, and really good high quality of life. So if you see at cohort studies, first we have these case reports. These are really striking, really look good, but you want to see the numbers, right? So if you are treating large number of patients, you don't want to pull out the best cases, you want to show that it's really effective. So there were the earlier studies, and then still we also do this, of course, in a retrospective or single-arm way, to match them to historic cohorts or case-match studies. So in our center, we treated with hyperthermia a wide variety of tumors, including gynecological and breast cancers. So we designed a prospective randomized trial, which I will talk about shortly not too long, don't worry. And we had most of our cancer patients, however, are GI cancer patients, colorectal, pancreas, liver cases. And we had a few studies of the pancreas arm. However, we have now centralized the pancreatic cancer patients into a pancreatic center. So we couldn't extend it to the whole randomized way, even though the design is complete and we have registered also the clinical trial. But we will have to discuss that with the pancreatic people. So this was our first study in a case control manner that we analyzed our patients' outcome. These were inoperable cases, far advanced, no possible surgery, really poor prognostication and poor survival. And we have seen that we could extend it. So those of you who are not familiar with Kaplan-Meier curves, the higher the curve, the better the outcome, the lower it's worse. So the treated patients had much better outcome, but these were really only the poorest cases, non-operable and non-curable by normal treatments. So no chemotherapy because they just couldn't take it. And what we have seen there, that these patients had a very good response if they had a wider spread disease. This is really contradictory, right? So more cancer cells meant better response. And also if they had ascites, so fluid in the abdomen, they didn't respond, probably because the current went away. It couldn't autofocus much better on the tumor cells because the watery or the fluids take away the current. So we summarized our results and others of Dr. Fiorentini and everybody else into a meta-analysis. So it's maybe hard to see, but there is a line next to the letters. I just walk here for a second. So if you go back, if you would, thank you. So everything that's right from the line says hyperthermia is beneficial. So these are multiple studies, pancreatic, hepatocellular, cholangiocellular, or say you have to choose hyperthermia for better outcome. And this is also have seen with the local control, we have a better outcome. This is the line here, sorry. And if you see a shift to the right, that would say we have to apply modulated hyperthermia. So I don't want to bore you too much about genetics and pathology, but understanding cancer has proven to be successful in the era of immunotherapy. So we consider cancer now a disease between the immune and host system and an alien tissue, if you would like that. So there is a tumor immune interface in the background, which is being investigated further by other studies by this French group. And we can look at cancer in a way that they have different kinds of immune responses. So we respond through our immune system to these cancer types. And various immune cells can be profiled to see what's happening there. Do we recognize the tumor, or can we kill the tumor with our immune cells? So we consider now even chemotherapy and immunotherapy by introducing damages in the tumor cell, like hyperthermia of this device. So we can make our immune system to fight against the tumor, just causing damages by the chemotherapy. So we could just hop on to the next one. So I put already modulated electrohyperthermia in the immunotherapy panel, where we apply this approach, and we consider that an immunotherapeutic facilitator. So if you look at the tumor, this is how it looks like in a fluorescent staining. This would only say that there is a tumor, which are the blue cells on the left, and there is a stroma, which is green. we would see the immune cells in various dots and colors on the right. So this can be quantified, and we can look at it how we can maybe intervene in this response with either immunotherapies or modulated electrohyperthermia. And this has been proven to be a good marker for response. So in the near future, we would like to adapt our modulated hyperthermia technique to the immune system and its response, especially in the colorectal cancer patients. So what have we done now, or in the past years? We gathered some experience. Even though my supervisor and boss at oncology, she has been using oncothermic device for 30 years, for a certain period. But we relaunched in 2015. So it's 8 years almost. And there were some clinical trials. So this is more for the practicing oncologist, that we have witnessed really good results and responses in cervical cancer. This is Kerry Minar, PI, in South Africa, who designed this trial in her work group. And they were able to show that in earlier settings, so this is non-metastatic cancer, this is stage 3, 2. For me, it's non-metastatic because it's involving only the lymph nodes, but not other organs, so it's still regional. She has shown that the local response is really good. So the left is the best cases. So this would say with PET scan, they were able to decrease the metabolism of tumors and decrease the tumor sizes to a curable degree. And after follow-up of 2-3 years, she has shown that it really provides a survival advantage to administer oncothermia to these patients. Yeah, it's the red one upper there. All right, you could go on. And breast cancer, what we have learned and seen in the past decades, we know that there are this triple negative phenotype, which is more like an earlier phenotypic stem cell-like tumor, not expressing hormone receptors, so we cannot even modulate them with hormones or anti-hormones. Eastern European guys tend to be brave, not as brave as Indians, but braver than US guys. So they made a clinical trial in Poland with 10 breast cancer cases who were BRCA mutated from the germline's perspective. And they have seen a huge pathological response, meaning that the tumor has shrunken to 0 by the time of surgery. So they completed this clinical trial, and they have seen that this is an interesting phenomenon. If somebody bears this kind of mutation, probably platinum agents would help to decrease the tumor size. And we designed our clinical trial in an adjuvant fashion to go on with the ordinary oncotherapies and facilitate the response of the tumor, because we have now this kind of definition or phenomenon, I would say, that we can artificially introduce this BRCA mutation-like behavior into these tumors. So in those patients who don't have this mutation, oftentimes the tumors behave like. So we can, with the modulated oncothermia treatment, turn the tumors into this BRCA phenomenon. So when we give the therapies, they will respond in a much higher way. So with the era of immunotherapy, this can be exploited with other antibodies. We call pembrolizumab in this case, and it's now, the clinical trials have been completed to have a very, very high response rate. So incorporating everything in our clinical trial, which is now ongoing, we treat the patients for 3 months, 3 times a week, in parallel with the chemotherapy of taxanes and platinum. So we didn't supersede chemotherapy yet. We are not as brave, but we will see how much they respond, facilitated by hyperthermia. So the average response of these non-BRCA, non-mutated patients, without the immunotherapy is about 30%. We want to decrease this or double this if we can in our patients. So we will see in a few years with the follow-up and when we finish the study. And the other study is the neoadjuvant treatment in rectal cancer. We are just about to design, and we have the comprehensive cancer centers to join, which is a rectal tumor study. So this idea comes from the same way, that we want to cure more patients in earlier phase by the time they would get to the surgeon. And the Korean colleagues have already done some studies. They didn't go for the same goal. They wanted to introduce hyperthermia to have lower medical and radiation therapies. So if you see, they got lower irradiation, those patients, and they had the same results because they replaced the therapy with hyperthermia. So our study will not replace the study with hyperthermia, the treatment with hyperthermia, but we want to cure more patients. Same drug, more patients cured, okay? And this is just a background study, a few patients who were inoperable. To the manual people again, they were made operable by hyperthermia. So they the surgeons could remove the tumors and cure the patients with use of this device. And this is how our study would go on. As mentioned, our breast study is 6 months, but we treat them for 3 months with a specific chemotherapy. This is even shorter, so this is less than 6 weeks of treatment, because the patients have everyday radiation, a session of chemotherapy at the first and the last 5 days, and we give them every 3 days hyperthermia. And we will see, a pathologist will look at the samples, how much the tumor has gone away. Okay, so thank you so much. This is how I like to look at it. We had radiotherapy, chemotherapy. Now we have the age of targeted and immunotherapeutics, and also antibody drug conjugates, which has probably a revolution in front of us. But if we apply concomitant electrohyperthermia, we hope that the numbers of cancer won't increase more. We just keep them at least stable despite the doubling, and we will see how we can cure more patients. Thank you.
Thank you, sir. A great lecturer can ignite a lifelong passion for learning and inspires greatness in their followers. Domokos Mate is the head in vivo imaging advanced core facility of the Hungarian Center of Excellence for Molecular Medicine. He also serves at Semmelweis University, Department of Biophysics and Radiation Biology. He is a founder of CRO Med Research and Services Limited for therapeutic radiopharmacy, radiology, oncology, and clinical trials of imaging devices. Now, we would like to invite Dr. Domokos Mate, Senior Lecturer, Semmelweis University, to address the gathering.
Thank you very much, and welcome everyone at the last Hungarian speaker. I'm very happy to be honored to be present in the presence of Shri Mahalingam Manikam and all the precious and very valuable guests of honor. Thank you very much for coming, and thank you very much for honoring us to be here as an audience. We are very happy to start the use of a unique system in India for the first time at the clinic of Dr. Arul, established by Dr. Mahalingam. And we are very happy that we can share our collaborative experience with the world-leading universities and world-leading hospitals, invigorated by Indian experience and ancient wisdom. So, in my short speech, I would just like to emphasize 3 sentences which came up after hearing all the lectures. The first is, food be thy medicine. This is something which we can learn from Ayurveda, from Siddha, from ancient Hungarian sciences, and we can learn it nowadays as well. That's why Indian cancer incidence is much lower than anywhere in the world, because of it's around 1/4 of the world's cancer incidence. So 4 times less cancers are present in India than in the world because of spices, because of the microbiome. This goes to the second sentence, which is made by an ancient Greek doctor who called, like, the disease is there. Iron can cure the disease, meaning surgery will cure the disease. If surgery or iron cannot cure the disease, then fire will surely cure it. Fire being hyperthermia. This was stated 600 years before Christ. They were practicing hyperthermia in ancient Egypt by the use of iron heated to red, and treating breast cancer using iron heated to red. And they were practicing it in ancient Greece. But what is fire in modern ages? Fire is two things: immune systems effects and radiation effects. So we have to integrate the holistic use of our immune system and surgery to get the patients rid of the primary cancers, and we have to keep up the metabolic effects to keep the patient and its family free of cancer and to keep the cancer at bay. So that's exactly what we have learned when we came to Mirakle Wellness Clinic and Healthcare Center. And when we started to discuss with Dr. Manikam about mitochondria, we already felt at home at the first meeting. You remember we discussed about the miracle drink. So we have to keep metabolism in a way stable, and what comes as an essence to me here, by using oncothermia, we are restating order. We are using an electric field that resonates with normal orderly communication, that resonates with the intra-system love of normal cells, but will resonate against cancer cells, and will resonate to invigorate the immune system and attach the immune system to the tumor so that the immune system will clear it. And in order to use the maximum effects, we have to combine it with some other metabolic medical actions which we have learned from Siddha, which we have learned from Ayurveda, and which we have learned from Dr. Arul and others around the world based on vitamin C. Actually, as we go back to the inventor, not the inventor, but the discoverer of vitamin C, who was a Hungarian, Albert St. Georgi, he also had a famous saying, and that's why, with what I will probably close my speech. He said about life. He was questioning, later in his life, after the Nobel Prize, he was researching cancer, like for 30 years. And he came to the conclusion that cancer is a kind of metabolic disease in a subatomic proportions. So he said to himself, what is life? And his materialistic answer was, life is an electron looking for a home. So that's what we are getting back to the patients. And in their bodies, hyperthermic oncology, and in their bodies, oncothermia will restate the order of functioning love by the immune system and by increasing the electron flow through the resonance of the electric field. Thank you very much.
Thank you, sir. A great deputy director is someone who is approachable, communicative, and committed to build a strong and effective team. Mr. Parasuraman Padmanabhan is currently the head of operation in the Cognitive Neuroimaging Center with Lee Kong Chian School of Medicine, NTU, Singapore. Dr. Parasuraman has vast experience in establishing different in vivo imaging modalities for monitoring different cellular events in mice, rats, and non-human primates. He mainly focuses on developing new imaging assays for studying different cellular signal transduction networks in living animals. He has more than 30 years of research and teaching experience gained from several leading universities such as Cornell and Stanford University. Now, we would like to invite Dr. Parasuraman Padmanabhan, Deputy Director, Center for Neuroimaging, Lee Kong Chian School of Medicine, Singapore, to address the gathering.
Thank you very much for the kind introduction. So, respected Sri Dr. Chairman, so Honorable Sri through the Karthikeyan sir, because I just heard many times, but this is the first time I had an opportunity to meet him and be with him and have a conversation with him. That is a great honor and to be here. And my dear Hungarian colleagues, because I am associating with Domokos nearly 17 years, and we jointly developed several assays for cancer as well as for several metabolic diseases. And I learned the guest of honor, Sri or Murali, to be associated with our one of the, I want to call sage, because Mahalingam sir is really a great, and I met a couple of times and I had opportunity with a small conversation with him, and he is really great. The reason is because he adopting the concept of the Vallalar. So the Vallalar is really Vadiya Pairai Kanda Bodallam Vadinin. So that I am seen inculcated in his family. So I met Dr. Manikam sir 20 years before. So I was working with the government of India. I had an opportunity to associate with him and do work with him on certain aspect on the environment. I am basically environmentalist turned to the medical person, because the Stanford University taught me well about how to progress with the imaging. Imaging, what you are seeing is, documenting. So that's what the science is growing like anything. So with that word, I want to, please excuse my Hungarian friends. So I would like to talk in Tamil a little bit, because it's a big honor here, and also I want to start the word Sakti, because Sakti is the one named by Mahalingam sir, Sri Mahalingam sir. So there is a saying, Sakti illayel Sivane endru. That means energy. Then I met him after 20 years. Then the chairman sir told we have a drink, which is a very important drink. It activates mitochondria. Not only mitochondria, it maintains the mitochondrial activities and prevent the mitochondrial dysfunction. Because if the mitochondria is not functioning well, that means, the process, right? The pyruvate will enter into the TCA cycle. If the pyruvate converts to lactate, that means it is in inactive state. So Sakti illayel Sivane endru. The inactive state is a Sivan. So when the Sakti united, then there may be a energy production. That's what we are seeing in a TCA cycle, then ATP, ADP, and the chairmans are very rightly explained and in a detailed manner. So here, the Oncotham, I want to switch over to Oncotham here. So the cancer tissue always have the low pH, the hydrogen ion concentration, which is very important. The Oncothermia, the instrument, especially the waves which is produced, the MR principle, it is a partially MR principle, magnetic resonance imaging principle, the proton alignment. So how you can turn, flip the angle in the proton in MR principle. It's a similar principle, but there may be big but here, they are, tuning in such a way to make the cells, the cells rupture will happen, and finally the treatment, the cancer will be treated in a big way. So, why I am telling here, because, our country is having a very traditional, we cannot underestimate, all treasures are here. So, the Murali sir rightly pointed out, Unave Marundu. So now the turmeric is one of the, the best medicine for everything. So I want to start from the turmeric, because the medicine, which has the unique property. So if you want the wound in the wound, then we take the turmeric. If anything happens, even your memory power decreases, take turmeric. So turmeric has the value, the rich pharmacology. So I want to call it the rich pharmacology, or other words, in olden days we say that it is not a dirty medicine. So dirty medicine means it binds everywhere, but nobody will, know what it does. But now people had identified our turmeric has the rich pharmacology. So what it does means, when we treat anything with the turmeric thing, I think Dr. Arul, recently we had a conversation and he told that he going to use the turmeric, the curcumin infusion and want to treat the cancer. That may be a big success and I want to convey my best wishes for that kind of treatment to Dr. Arul. And in addition to that, so we have many generations and the generation to come. But this generation, what we have seen many sages. They have written many things, but we are not really following that path. So why? Because we are neglecting. So even our food habits, we are forgetting. And every time I come to Shakti Sugar or Shakti ABT, so I used to have a meal there. The reason is that still, the vegetarian traditional meal, you will get it, with a rich, the nutrients. So it clearly indicates that the chamans are, not whatever the traditional value he is bringing us. The one addition is the Mirakle. The first time I came to Mirakle, this is really a wonder for me. Even though I met Dr. Arul 15 years before, I didn't remember. After discussing with him several times, then I asked him, so this is the same person you are in Chennai before? He said yes. So it was really very fortunate working with him for the past 6 months. In his talk, he also mentioned the thing is because I did analysis and I talked to all my colleagues and friends, those who are in the medicine, including Stanford University professors, and which one is the good to adopt, because there are 3 different machines and which machine is good for treating cancer non-invasively. That is very important. It is not invasive, because nowadays even we have a rich the experience in several things like the sages has written, but we are not following that one the same way. So we analyzed how it can be adopted. So then now we have a time with the Oncotherm experiment to experiment many things. And even my friends, when I discussed, and Domakosh is witnessed, and he was all the time he asked some new things. So what is this? Why this kind of treatment the village side they are following? He reads every day, and every day we speak together. Speak on the phone, then he asks what is this one and why this kind of things are using. So this is really a eye opener for especially our people to follow the traditional medicine, and also Dr. Arul is going to adapt many the traditional the practice what we are using along with the Oncotherm instrument. I think definitely we going to like the whole entire world will going to look at us, because what we going to share to the world in the future, that may be a reality. And with that, I want to conclude that so that this equipment especially very important in terms of the treatment, because it is called the Orungineinda Maruthuvam. That's the integrated therapy. The integrated therapy, now the whole entire world is adopting several techniques like chemotherapy and other therapeutic approaches, including antibody targeted therapy, which is now most of the cancers they are treating, they are successful, they are reporting. But this integrated medicine, so why it is so powerful? Because in India, especially in Tamil Nadu, we are educated with the different disciplines. So we are not coming closer, and we are implementing this kind of the technology developments. I think I request to the young generation, so the people, those who are interdisciplinary, here it is very in Oranganaitha Maruthuvam, the same way, the interdisciplinary approach. The people should think about not only the IT is very powerful, or engineering, the one direction is very powerful. You have to think it over how you can implement this kind of the platform, and with the different the area of research or subjects, and finally you conclude, work with the doctors, work with the engineers, and finally you can conclude some innovations that will help us to progress further and to save our community and better living. Even though we are the low number of cancer patients in India, especially in Tamil Nadu, even lower to the entire population in India. So we have to focus, and we like integrated medicine. So we have to form an integrated platform in education as well. We all come closer, and we have to invent something that will be useful to the mankind. And also, finally, I would like to thank Dr. Arul, Dr. Chairman, because they have given me opportunity to bring this equipment here. And not only that, and several times I witnessed Dr. Arul has developed several techniques that I came to know when I went along with him to the Europe trip. And he met the doctors, and he asked very sensible questions, which is on the basis of scientific as well as on the basis of the focus, the treatment. So I was really surprised to see Dr. Arul has a vast experience on the disease, not only in cancer, but also in many other metabolic diseases. And he asked very sensible questions, and he taken home message that how to treat all the diseases, not only cancer. But I also underwent some treatment under his hand, and I congratulate him, and also I wish him all success. And in future, this Miracle Clinic will be on the world map for sure. Thank you so much.
Thank you, sir. Gratitude is the fairest blossom which springs from the soul. Now, we would like to call upon Dr. I.S. Tasmiya Banu, Medical Consultant, Mirakle Integrated Health Center, to propose vote of thanks.
I am pleased and privileged to propose the vote of thanks and convey my gratitude to all who stood in making this inauguration of hyperthermia, first of its kind in India, for cancer treatment. It's a bloom and miraculous treatment for the last stage of cancer patients. And I would like to thank our chief guest, Padma Shri, Dr. Karthikeyan, former Director CBI, for inaugurating hyperthermia at Mirakle Integrated Health Center. Thank you, sir. Heartfelt thanks to Shri R. Murali, Program Executive, All India Radio and Doordarshan Kendra, Coimbatore, for consenting to be a chief guest of honor. Thank you, sir. I extend my gratitude in thanking our on-site dignitaries from Hungary and Singapore. Thank you. And I extend my thanks to Dr. S.V. Kandasamy, Chairman, Vedanayagam Hospital, Coimbatore, for making his presence and addressing the gathering. Thank you, sir. I thank Dr. M. Manikam, Chairman, Shakti Group of Companies. And thank Dr. C. Ramasamy, Secretary, and Dr. S.V. Subramaniam, CHRO, NA Educational Institute, Dr. Arulsan, and Miracle Wellness Team. And I also thank press and media, professions, and doctors from various places, and thank you all once again.
National Anthem.
Jala jala
Announcement. Lunch is arranged for all the dignitaries and invitees. Kindly join at VIP dining hall. I repeat, lunch is arranged for all the dignitaries and invitees. Kindly join at VIP dining hall. Thank you.